Well, can you guys hear me okay? All right, good. Well, thanks for letting me come back again. I think this is largely the same crowd that I've talked to several times before. So,
We're all still here.
oh well, I have a couple slides that are repeated. So let's see if you can remember from 2 years ago which ones it were. I could have called this "Food as Medicine" or 100 different titles, but healing chronic disease with lifestyle changes is kind of what I picked for this. My passion over the last 4 years has really been into trying to do wellness and prevention instead of adding another medicine and adding another medicine. I've been practicing for 16 years now, and I've been up on the guidelines and following everything and checking my diabetics A1Cs and putting everybody on cholesterol medicine who is supposed to be on cholesterol medicine, and yet every 5 years or so I watch my patients get sicker and sicker, and we add more medicine and they get more side effects and they come back with more problems. So it really hasn't helped, and despite being able to put stents in hearts and do bypass surgery, I'm still finding people where the disease just continues to progress. So lifestyle medicine is something that I've become very interested in, and it's how do we change our lifestyle and how can we affect our diseases and what medicines we have to take. When I started talking to patients about this maybe 6 or 8 months ago, my goal for 2016 as a doctor became to look at a patient and not look at what medicine I needed to add, but looking at what medicine can I take away. And so my goal really now is to get people off of medicine, but that takes a lot of work and it takes a lot of time. Very difficult to do it in a 10 to 15 minute visit. It's almost impossible. But when I talk to people about little changes they can make in their lifestyle, most people are pretty willing if it means we can get rid of one pill or maybe at least cut a blood pressure pill in half. So we started a wellness program at Liberty Family Care, and that's what we've been working on, like an 8-week program. And I'll tell you a little bit more about that at the end if you're interested. But let's go on with this. Make sure my clicker works. All right, this is a slide from last time, but one of my first favorite slides. Preventive medicine kills return business. True. If I do my job very well and I keep people from needing procedures or from needing surgeries, the healthcare business is going to go down. But as we know in this country, it's a huge problem right now. There's not enough money to go around. Our deductibles are going up, Medicare copays are going up, and it's getting more and more expensive. So it will kill return business, but that's good because then we can focus on the type of things that keep people out of the hospital and prevention of cancers instead of treatment of cancers. So this is me just very quickly, hasn't changed. I think the only reason that's a long list of stuff I do is I'm realizing that that comes with age. Your list gets longer. I used to think it was somebody who was really smart or worked really hard. No, it's just an age thing. This is the other title I wanted to call it, How Eating Plants Can Reduce Your Dependence on Medication. And that's true because a lot of it does have a lot to do with plants, and we'll talk about that a little bit more as we go along. One of my favorite farmers market pictures. I've become big into farmers markets, and I try and get people to buy locally and support the market here. I wish we had something huge like this that was open several days a week, but I think socially and culturally in this area we're making progress towards that, but we're not there yet. This is a little thing from a couple years ago. Adverse drug reactions. You know, why get people off of medicine? Why? I have people that are on 2 medicines. I have people that are on 15 medicines, and it seems like the sicker people are, the more medicines they're on. And there are days that I wish I could put someone in the hospital and take away all their medicines and then really figure out which one they need. But we can't do that anymore. Medicare doesn't pay for that. Greater than 100,000 deaths per year, according to the Journal of the American Medical Association, related to adverse drug reactions. And 21% of the most recently FDA-approved medications were withdrawn or were given black box warnings. So medications are not safe, and we have our culture has an infatuation with medication that we need a pill for this and we need a pill for this. When I first became a doctor, they were not allowed to advertise prescription medications on TV. And since that has happened, the sales of pharmaceuticals have skyrocketed, and it's a multi-billion-dollar business. So there are companies that are advertising to you that want you to get their medicine. And what they don't tell you, what they tell you is ask your doctor. What they don't tell you is most of those medicines on TV are new, and they're in the, most of them are in the $250 to $400 range per month if you were a cash pay. And in many of them, that's what your insurance is paying, even if your copay is $30. So I'm going to go through this briefly, but some of the categories of medicines, now that people are becoming more and more dependent on medicines and there are more guidelines to put people on medicine, there's so many drug reactions to look at and to watch. So statins, I'm sure many people in here are on a statin. This is a cholesterol medicine. Pravastatin, atorvastatin, Lipitor, Crestor, which just went generic, by the way, if any of you are on it, and Simvastatin. Many problems have been known with the skeletal muscle effects. That's been known for years. I would say almost 50% of my patients that I've prescribed statins to cannot take them, or at least have significant side effects. Usually muscle aches, sometimes it's joint pain. Sometimes people actually get muscle tissue breakdown and end up in the hospital. So if you're on a statin and you have kidney disease, or you're on the drug metformin, or you're on some of these other medications that can make you more likely to that, it's something that we have to watch for. People with chronic liver disease should not take statins, and yet fatty liver disease is one of the complications of vascular disease, and so that goes hand in hand with high cholesterol now. So many people on statins that need to be on it also have liver disease, and that's kind of a gray area right now in medicine. Cannot take with fibrates. The FDA just issued a new warning maybe less than a month ago that if you take fenofibrate, you should no longer take a statin with that. Before, those have been used in caution. So if any of you are taking fenofibrate and a statin medication, don't just go stopping it, but talk to your doctor within the next few weeks about whether or not you should continue both of those. Just because they've decided that getting your triglycerides down, which the fenofibrate does not help survival all that much, and the risk of those two drugs together is worse than the benefit of taking them both. And these are things that, you know, it takes a long time for this science to come around. So if we can get you healthy without starting the medicine in the first place, that's kind of the better way to go. That's just statins. PPIs, these are the proton pump inhibitors, your acid blockers for your stomach. Omeprazole, Nexium, Pantoprazole, PPIs. Proton pump inhibitors are for the treatment of reflux mostly. They also treat ulcers and some esophageal problems. But the majority of my patients that I see are taking them because of acid reflux. However, in the studies, and this information is from the package insert for omeprazole, which is available over the counter now. Many people take it chronically. It's only recommended for the treatment of reflux up to 4 weeks. After that, it really hasn't been tested. And we could see some of the long-term effects. It hasn't been tested and approved, but we know that with long-term, it's blocking your stomach acid, and it can cause some problems in the stomach long-term. People with kidney failure have to be very careful because it can exacerbate that. Long-term use can cause vitamin B12 deficiency, which is necessary for most of the chemical interactions in your body. It decreases magnesium, so technically we should probably be monitoring on magnesium anyone who takes this chronically. And it decreases absorption of a lot of other drugs like antifungals. Something I found in the package insert that I wasn't aware of, it can give you a false positive drug test for THC, which is marijuana. So if you're getting drug tested for work or for anything else, you can actually have a false positive for marijuana if you're taking Prilosec. The very last thing, increased osteoporosis, has not been proven yet, but there are studies suggesting that that can make osteoporosis worse or make you more likely to get osteoporosis, correct. and that has been in the news. I wouldn't say, from what I could see, there was enough evidence yet, but it's starting to suggest that, so it may happen. Insulin. Insulin for diabetes. Sometimes it's used quicker now, and now I'm talking about type 2 diabetes when I say diabetes today, which is different from type 1. So the children who get diagnosed with diabetes and get insulin pumps, it's kind of a different beast than what we're talking about type 2. Insulin in people with type 2 diabetes is given at much higher levels, and at those levels it can cause weight gain or at the very least difficulty losing weight. Low blood sugar and high blood sugar, and there's many drug interactions with insulin, and not to mention it is incredibly expensive unless you're getting the generic old-fashioned regular, which really has a lot of low blood sugars. Incredibly expensive. SSRIs are antidepressants: Prozac, Celexa, Zoloft, Lexapro. These have been out. Prozac was the first one that came out, and that was in 1988. And pretty much for the first 10 years they had the market. So it's felt to be safe. It's used in pregnancy. It's been around a long time. Yet there are a ton of drug interactions. The black box warning the FDA issued for all antidepressants, not just the SSRIs, was an increased risk of suicide. This is much higher in teenagers. And I haven't seen this study myself, but from some of the lectures I've been to, I've learned that most of the kids that you've heard about that have gone berserk and either killed themselves or the mass murders and some of these shootings, that almost all of them have been on this type of medication, an SSRI. So the question is are they picked up and they're getting treated and they were just, treatment isn't strong enough to help them, or is the treatment actually hindering some of their problems? We don't know. That question hasn't been answered. It has a lot of side effects. Serotonin syndrome is increased anxiety, agitation, internal restlessness, and that comes from serotonin, which is part of what this medication regulates in your brain. Migraine medicines, Tramadol, which is a pain medicine, Flexeril, which is a muscle relaxer, all of those will increase serotonin. So I have a lot of patients that go to one doctor and get this medicine, go to another doctor and get this medicine, and then they come in and they're just jittery and they say, I need more Prozac because I'm too nervous, and they're actually having side effects of that, which can be very severe and cause hospitalization. Sexual dysfunction, low sodium, and I have had to take people off of these because of low sodium. So some of these, they're not, even though they're rare, they're common enough that I see them in the practice in Liberty. And then opiates, I could go on for 2 hours and talk about all the dangers of opiates, so we won't. It's just that more people die of drug overdoses on opiate medicine, prescription opiate medicine, than die in motor vehicle accidents in the state of South Carolina now. It has surpassed it. So it is a dangerous drug. Even if you're taking it appropriately and you're not an addict and you're doing what your doctor says, it's still very dangerous. All right, so we'll switch off of that a little bit and go to food. I'm interested in food. I love food, and most of what I talk to people about in the rooms now is food. But it's a big difference between this country in 1900 and this country now in the way we eat. And that probably has a lot to do, and in fact it does have a lot to do. There's a lot of science that backs this up, that shows in 1900 the average American ate 131 pounds of fruit per year. Today, for 2010, we're only 11 pounds of fruit per year. The little fruit gummies don't count as fruit. Kool-Aid is not fruit. I've had a lot of people, and believe it or not, there are a lot of people that think that. So fruit contains fiber, fruit contains a lot of vitamins and nutrients, and our kids are not getting that these days. We are not getting that as people. And these are nutrients that the body needs to heal, to keep the inside of the arteries open. And a lot of times, many of this weakness and lightheadedness and hot flashes and nonspecific is because we don't have the right nutrients in there. In 1900, the average person ate 2 pounds of cheese per year. Anybody want to guess what it is now? 30 pounds. Pretty close, pretty close. 30 pounds, yes. Pizza, cheese. I quit eating cheese about 4 years ago. Not because I don't love it, but to go to a restaurant and look through the menu, and I'll go down and eliminate everything with cheese. A lot of times it's 1 or 2 items left. Cheese is on everything. I have people tell me all the time, I don't eat dairy. Well, do you eat cheese? No, not that much. When you really look at it, it is sprinkled on salads, it's in mashed potatoes, it's in rice, it's in everything. So these are oils and fats that are just sneaked in little amounts chronically over the year, and it results in this much more. Oils and fats, 1900, 4 pounds. So oils and fats are what in processed food. The majority of Americans are not getting their oils and fats like you would think from red meat. There is a lot there, but the majority of our intake comes from processed foods. French fries, potato chips, Little Debbie cakes, all of these things contain oils and fats. So today, or several years ago, 74 pounds, up from 4. So 70 pounds more. And this is why we have a childhood obesity problem right here. It's the junk food that they're eating. And a lot of it is marketed as health food, and we'll get to that towards the end. Sugar. Sugar is a drug. Sugar is good, and humans love it, and when we get it, we want more. And this is a proven fact. If you have sugar, if you feed mice sugar, you feed any animal studies sugars, they will do it. Humans do the same thing. If anybody has used to drink soda and doesn't drink it anymore, and you go and have one, you might not drink the whole thing. It tastes too sweet to you, but sure enough, within a few hours or by the next day, you're going to be wanting another soda, and I'm proof to that. So it does have an addiction thing. So sugar is recommended to be limited. Today, 200 pounds of sugar. This is mostly soda. This is mostly soda and Gatorade and energy drinks for our kids. But adults too. I see plenty of moms who do not eat all day, but they drink probably 6 or 8 sodas throughout the day. So they replaced those fruit, which contain the nutrients and the fiber, with soda, which contains sugar and acid. Soft drinks weren't around in 1900. Now 53 gallons a year average. And I don't drink any, I drink very little, I should say. So somebody's drinking more than 53 gallons. And then to meat. Always Americans have been big meaters. 140 pounds of meat in 1900. It's always a staple of the diet. Most people, farmed, and then they had, meat was kind of a treat. But obviously we still had a lot. They didn't eat it every day. Now we're up to 210. So about 70 pounds more of meat per year per person, which is what, a small hog? Yeah. So speaking of meats, processed meats, which include deli meats, hot dogs, bacon, yes, bacon, Spam, any of the processed meats, ham, anything that's salted and cured is a processed meat. The World Health Organization last fall went through over 800 studies, scientific studies, looked at all the data, and they were able to say that processed meats are a class 1 carcinogen. They do cause colon cancer, increased risk of colon cancer, and that is factual enough for them to call it a carcinogen. So other class 1 carcinogens are cigarettes, asbestos. So processed meat is now up there with cigarettes and asbestos. They may not be as strong, they might not be as likely as asbestos could cause cancer, but people who eat a diet high in processed meat have an 18% increased risk of colon cancer. Colon cancer is one of our leading killers in this country. So this is something that we can, now that we know, we can get this out of our diet. This statement was made in October of 2015. So several months ago. It was on the news for about 2 days. Haven't heard of it since. And I don't know if any of you had heard this. You show of hands, anybody have heard this study? There's a couple, okay. But yet you don't hear about it. It is really kind of kept under, we don't want to give up our bacon. The doctors won't want to give up their bacon any more than patients. The people doing the research don't want to give up. So it's kind of ignored. Cigarettes were ignored like this in the 50s and the 60s for many years too. Many of you probably remember going through the hospital or working at hospitals where the doctor's lounge was smoked. The patients smoked in their rooms. Mothers were told to smoke because it reduced their anxiety with rearing children. It was touted as a good thing. And that's kind of where we are now with some of our dietary things, including processed meats and bacon. And then the other big part of our diet that I think is really important is fiber. I take care of problems every day in many kids and adults, but we have a fiber deficiency. We are obsessed with protein. If you look through Facebook, if you look through the internet, where you're going to get your protein, you need this, you got to have protein for breakfast, you got to have this. The nutrition education programs have been focused on this, and this is the way we learned. This is what I was taught in medical school. We've been focused on protein and infatuated with protein, but we really have a fiber deficiency. Fiber is what is needed in the colon to bind up the cholesterol. So if you have high cholesterol and you're eating cholesterol, which is in meats and the fats and the oils, it's fiber that binds up that cholesterol, sticks to it in the colon and shuttles it out of the colon and out of your body and keeps it from getting absorbed and going to your arteries. And you also need fiber in the colon to prevent diverticulitis and colon cancer, and you need it to feed the good gut bacteria. I will talk, if we have a little bit of time at the end, about gut bacteria, but we have literally trillions of bacteria in our gut, good ones and bad ones. The good ones need fiber to eat, and if you're not eating fiber, they're going to go away and not live, and you'll have more bad bacteria, which means more C. difficile infections and diverticulitis and risks of these types. So fiber is very important. Fiber comes from plants. It only comes from plants. It does not come from animals. So fruits, vegetables, lettuces, leaves, whole grains, barley, oats, bulgur wheat. This is where fiber comes from. I'm not going to go through all these studies. Actually, I'm going to switch to, can I switch to the PowerPoint? Okay. These are some slides from my wellness program, and we go in a lot more detail, but to fix all these problems, we learned where we're deficient in food and where we have too much of some of the bad foods, but lifestyle changes are always recommended before medication. So if I look at the American Heart Association or the American College of Cardiology, to fix high blood pressure or high cholesterol, lifestyle changes are first, which means diet, exercise, eating right. I'm not really trained how to tell people what to do. The nurses aren't usually trained to tell people what to do. We've been told low-fat diet for years, and now we know there's not really evidence of that. If you go and you look on Facebook, you look on the internet, they'll say, eat more of this, don't eat these are bad, don't eat, and it's confusing, it's very confusing. You read something one week, and you read something completely opposite the next week. And yet lifestyle changes is what we're supposed to be doing first. So there is a whole new group of medicine that's teaching doctors and nurses and nutritionists and educators how to teach people to be healthier with lifestyle changes. And this is the way I see primary care medicine going over the next 10 years. This is what it's going to take to get people off of medications and have less surgeries and less cancers. But we don't hear about it. The other thing is the word nourishment. I've used that in a couple slides. Nourishment is what, by definition, the food or other substances necessary for growth, health, and good condition. So when we pray, thank you for this nourishment, we are talking about the foods and substances that we're putting in our body to help it grow and thrive, which we know sugar is not, because we've talked about what that is. We know the oils and fats are not nourishment. We don't get value. It's the fruits and vegetables. So the next time you are praying for nourishment for your body, think about what it is in front of you, or if you're at a birthday party when it's cakes and sodas, or if you're at a scout meeting that's Doritos and hot dogs. This is not necessarily nourishment, and we really need to think about getting actual nourishment into our bodies. How are we doing on time? We're good. I'll go faster. There are tons of scientific studies that we could talk about. I have lists of other ones, and if anyone's interested, I'd be happy to share sources with you. But Dr. Ornish, Dr. Dean Ornish, he was probably the original lifestyle doctor. He has a lot of data, and he has a program that is now covered by Medicare. So he's got his patients through the program. He's proven that it works, that they get less heart disease, they get less cancers, and now Medicare is paying people to go through his program. But what his trial was that proves that it's better is he took an experimental group of patients, and they did lifestyle changes only. And these are people with heart disease. Everybody in the trial had heart disease. So the experimental group, they only did lifestyle. The control group was put on standard treatments, medicine, surgeries. Some of them took statin or cholesterol medicines, but half of them didn't, probably because either they didn't want to, they were afraid of it, or they had side effects. In the experimental group, the people that only did lifestyle, no medicines, 99% of them stopped or reversed their heart disease by the end of the study. I want to say this is a 5-year study. I don't remember the details right now, but it was over several years. 40% of those people decreased their LDL cholesterol without any medication. So 40% of them had lower cholesterol. And then when they measured the blood flow in their heart, a PET scan is a radiology study to measure blood flow. So a lot of times it's used for cancer, but it's used in research. A 300% increase in blood flow to their heart on the PET scan. So that was amazing that they were actually able to measure that. Now the control group, the people who were on the cholesterol medicine did better than the people who weren't. But there were 2.5 times as many heart events in than the experimental group. So the people who had the standard medicine, whether you had cholesterol medicine or standard treatment, had 2.5 more times heart attacks, admissions for heart failure, anything that they would call a stroke, that would be called a cardiac event. So he proved, and this was a big trial with a lot of people, and it was well done, that you can, when you really, really work with people and have them change their lifestyle, that you can do better than you can with standard medicine. And there have been a lot of trials since then that are also coming up with the same results. So what is a lifestyle? I can't tell you everything here because it would take hours. Dr. Ornish's program is probably, I think it's like 18 or 20 something hours. But if you're going to do a few things, processed foods, that's your fats and oils, and we saw how many more of those we eat now. These contain ingredients that are refined and broken down. It's no longer food form, so it's not absorbed or digested the same. Anything with white flour, so white bread, white pasta, Little Debbie cakes, snack cakes, granola bars, anything that has sugar and refined flour, which is a lot of their foods. Chips, anything that contains artificial colors, flavors, preservatives. You look at the Gatorades, they've got bright colors. I treat a lot of ADHD, and a lot of these artificial colors in certain kids will make them extremely hyperactive. And if you've ever been to birthday parties and seen there's always 2 or 3 kids after they get into the soda or Gatorade and the brightly colored frosting on the cake, there are some that are literally going berserk and jumping around the room, and you're always thinking, what is wrong with that kid? They're probably chemical sensitive people. And when I talk to some parents of my ADHD children, a lot of times when I tell them this and I say, you may want to watch, they'll already say, red, he can't have red, we know. And so people are observing this, and yet it is in our food. A lot of companies are starting to get this out. General Mills just did, and over the last 2 years, there's been a lot of petitions because in Europe, they're not allowed to use the artificial colors that we use here. So this part's getting better. Processed foods don't really have any fiber. They're high in salt and oil, and now they're being associated with leaky gut and inflammation. And that's another whole story of the gut bacteria that I alluded to earlier. Added sugar. I call sugar the hydrocodone of foods. So people who like their hydrocodone and Lortab, most of us like our sugar in our foods. It's just that tempting for humans. It's not an essential micronutrient. We don't need sugar to live. We like sugar, and it can be part of a fun diet, and it can be part of a healthy diet, but it has no essential need for us. Sugar gives us a quick burst or high. It sends your insulin level up, but then it shows your blood sugar shooting down. And then when it shoots down low like that, you get hungry again for more. And that's kind of how it causes you to want to eat more and crave more sugar. It regulates dopamine in the brain. When you eat sugar all the time, just like a drug addict who takes drugs every day, their receptors in their brains change. Same with sugar. So for people who are drinking 6, 8 sodas a day, the receptors in their brain, which is dopamine is the pleasure receptor, it actually changes. So when you take someone like that off of sugar completely, whether you put them in the hospital and dry it out or you get sugar out of their system, those brain receptors will change back, and a lot of times the depression goes away. There's all kinds of forms: sugar, cane sugar, corn syrup, high fructose. I have a list that I give my patients of everything with sugar, and it's entirely a full page of different names of sugars that are in foods. Animal foods. Any animal protein is anything that comes from an animal, not a plant. Dairy is cow's milk, cheese, yogurt, butter, sour cream, ice cream, cream cheese, whipped cream. Meat, poultry, and fish, those are included in the meat. A lot of people don't count chicken as meat when I ask people when they eat meat. I wish I had the data for how much chicken we ate in 1900 and how much chicken we eat now, because I bet you most of that 70 pounds is probably chicken from Zaxby's or Chick-fil-A, at least in this community, what I see. And eggs, which contain, by the way, 300 milligrams of cholesterol. And our liver makes cholesterol, so we don't actually need to take any cholesterol in.
The cholesterol's not in the white of the egg, right?
No, but there is methionine in the egg whites, which causes an acid reaction in our blood to break that down. It's
The white of the egg is not good for us?
it depends on what you read, but no, I would say no. I would avoid it if you could. So animal foods, without going in a lot of detail, when you look at the science and you look at all the things, and I'm kind of a science nerd and I read the studies, and I've really been looking into this and going to a lot of conferences for 4 years. You compare all the diets that there are, paleo diet and all the different diets, Mediterranean diet, plant-based diet, vegetarian diet. When you look at the data, the people who eat the closest to a whole food plant-based diet, which is purely plants with little oil, no processed food, little or no sugars, those are the healthiest people. Less cancer, less heart disease. Reversing, if they start it now and they have disease, they tend to reverse it over years. This is just a picture of a sweet potato recipe, because part of the one of the hardest things for people to change is we don't know how to eat. We've been given processed foods and we've worked our schedules around them, and a lot of my people, if I tell them don't eat this and eat all this, they don't know what to eat, and all they have is salad with carrots every day, and you can't, after 3 days of that, you're going to be bored and you're going to give up. So part of learning lifestyle changes is learning some new things to eat. This is a sweet potato that has farro on top, which is a grain, kind of a nuttier tasting rice, almonds, cilantro, and onion. I like tomatoes on there too. These are some bowls. These are some, I call them grain bowls. So basically you take a grain, brown rice, farro, or beans, chickpeas in this case, and you put it, and then you add some vegetables and you add sides around, and you kind of make it into a big salad. You could put it over a salad of greens, but there's so many varieties. So these are just a few that mostly I copied these off the internet. But you could take a side of squash and a side of Brussels sprouts and put them together with some couscous, which is another grain, whole grain, carrots, add some seeds on top, pumpkin seeds, and then some type of dressing for flavor. And there's a lot of varieties: quinoa, broccoli, cauliflower, chickpeas, and radishes. So flipping back to lifestyle medicine a little bit. Lifestyle is the choices we make every single day. So you all made the choice to be here today and to sit here and listen to me go on and on about this. But that's a choice because you're interested in getting healthier. Every day you get up, you make the choice whether or not you're going to have coffee, whether or not you're going to put sugar in that coffee, whether or not you're going to put cream in the coffee, whether or not you're going to have a refill. So we make hundreds of choices every day, whether you're going to walk up the stairs or take the elevator, where you're going to park in the parking lot and how far you have to walk to the door. But every healthy choices we make, we feel better, and we feel better quickly. And this is proven in the studies. The people who are kind of forced in the study to do the lifestyle changes and who are guided along by the doctors and given food and taught how to cook and taught how to walk or do exercise that their body can handle, they feel better quickly, within weeks. And again, lifestyle change is always recommended as first line before medication, and yet we don't do it because we don't know how, or it's not paid for, or it's not convenient because you don't have the community support to do it. If you go out and you make serious lifestyle changes and you say, I'm going to go to the healthiest diet and do everything she can, and then you go to church the next day and you're helping with the meal and there's nothing that you can eat there, you're going to give in because you want to fit in and you want to be with people. So it's very difficult to go in this community. So what we need are people who are committed to this, and they become the champions, and they go back to their schools and their churches and their works, and they say, well, I'm going to be the one to bring the fruit tray. I'm going to bring the vegetable tray. I'm going to make this new type of food. And so you may have to be the weirdo for a while, but people start to see how much better you feel, or that you're on less medication, and then people will start to change, and it takes a while. And lifestyle, I've been talking about food, and that's what most of this lecture is focused on, but lifestyle is not just food. There's basically body, mind, and spirit, and those are the three main things. Body is nutrition and food, but it's also fitness and exercise. I don't like the word exercise because that scares people and they say, yuck. Fitness is more like it. In some of the healthiest places on earth, I don't know if anybody's heard of blue zones. There's been a lot of books and a lot of media written about the blue zones. The people who live in the blue zones, which are the cultures where they don't have cancers, they don't have heart disease, people live until into their 90s or 100 years old, very commonly, without disability. We have, in this country, we have 7 years of disability at the end of our life. Most people will have some type of disability for the last 7 years of their life. And they don't have them in these cultures. They live old and then they just die. But those people do not exercise. They don't go to the gyms and have gym memberships, but they walk everywhere. They mostly have gardens or work in their yards. They don't have gardeners. They are moving and working every day, or they have jobs where they're moving and walking. And those people, if they had a Fitbit, they're going to have 20,000 steps a day, whereas in our sedentary job, in my sedentary job, if I don't do anything else, 3,000 a day. So that's just part of the proof that, you know, just moving and walking makes a big difference. And then mind, stress, peace, satisfaction. And a lot of people will add spirit or soul in there because love and support are very important also for a peaceful life. And if you don't have that, or you don't feel a connection with people, and you don't have peace, your cortisol levels are going to be high, your hormones are going to be off, and none of the insulin or diabetes or any of this is going to be able to be regulated if you can't find peace with yourself. So part of lifestyle is training people to do this, and a lot of times without medication. And our standard American diet is SAD. That's the acronym for Standard American Diet. It is our #1 risk of death. When you look at our leading causes of death, which are heart disease, colon cancer, lung cancer, Standard American Diet is up there for most of them as a cause, or at least a partial cause of many of those problems. So even if you change partially, it's going to make a huge difference. Even if you change your diet completely, it's going to make very quick changes. Within 2 weeks, people will come down on insulin or off of insulin. Within 6 weeks, cholesterol will change dramatically. Weight will change. But even if you just do little changes, giving up the soda for one, that's a big step, and it's going to make big differences. And I've seen people do it when their A1Cs 3 months apart. And the more you change, the healthier you become. So my recommendation for people is pick 1 or 2 things that you think you can do, and do those first. And you have to be able to do it and commit to it, because if you jump in and you do everything at once, you can do it for 2 weeks, but then it gets hard. So do something you know you can do and keep doing it. And when that becomes a habit, in 3 months or so, then you add on another little thing, and you just kind of challenge yourself to get better and better. These are chronic diseases all associated with our diet, our standard American diet. Thyroid function, osteoporosis. Yes, osteoporosis is worse in societies that eat more meat. In these blue zones where they don't eat much, they eat very little meat or not a lot of meat, they don't have osteoporosis. So the calcium from cow's milk that I was always taught to tell people to drink so they wouldn't get osteoporosis, it actually, in people who don't drink milk, they have less osteoporosis. So there are reasons for that, which we don't have time to get into, but there are some diseases that you wouldn't think would be diet related that actually the evidence shows they are. Low back pain, herniated discs. If you don't have good blood flow to your back and your spine, you're going to have more problems with arthritis, spinal stenosis pain, herniated discs. So as soon as you start adding more fruits and vegetables in that diet, your blood vessels are going to open up, you're going to get more there, and people actually have improvements in their low back pain just by adding more fruits and vegetables in their diet. And then the cancers, breast, colon, prostate, liver, very, very strongly linked to diet. And the autoimmune diseases, rheumatoid, lupus, osteoarthritis, eczema, psoriasis. Huge links are being found now between our gut bacteria, which is controlled by what we eat, and also especially with dairy for eczema, psoriasis, asthma, which should be on here and is not. A lot of studies now showing links with dairy as a cause of that, and reflux too. The optimal diet is little or no processed foods, mostly plants. And you look at any dietary study, even the people who believe in the Mediterranean diet and some of those, it's still mostly plants. It's 80% plants. So all these doctors who tend to disagree with each other, all of them think that 80% of our diet should be plants. So the science and the evidence is very strong. Cutting out added sugars, everybody agrees on that. Little salt, little to no oil, little to no alcohol. Here's your baked potato again, just another meal idea. Baked potato bar for family gatherings. Some of the things you could do are baked potatoes and sweet potatoes and have a lot of toppings out. Mango, roasted vegetables, onions and peppers, mashed up avocado on a sweet potato. It sounds odd, actually very good. Sauteed tomatoes, hot sauce. My husband's favorite is a baked potato with onions, green peppers, and hot wing sauce. And that's something that you can actually order some of this at a restaurant. If you're eating out and you're trying to often get a baked potato and a side of broccoli or salsa, and I kind of put it on top myself and say leave off the cheese, butter, bacon. Those are the bad parts of the baked potato. Maybe if I'm allowed to come back next year, we'll do a little cooking demo, because and I am not a chef. My kids tell me every day I can't cook, but I have had to learn these things as a working mom. How can I actually get something healthy for my kids that they will eat? So the recipe on the handout, if you like one, is corn and black bean burritos, and it's tested by my children and my office staff, and none of them are big vegetable eaters. And this is something that people will like. And every ingredient in it is easy to get, quick to prepare, and healthy. So these are all the studies, and I'm not going to show you all of them, but every one of those red dots shows studies that show the benefits of closer to a whole food, plant-based diet and how they impact cancers and heart disease. And the conclusion is high in plants with little or no animal protein, low in processed foods, and it can help prevent the most common causes of death and slow down or even reverse existing disease. High blood pressure, thyroid disease, diabetes, cholesterol, heart disease. There's plenty of evidence that shows this. I am off of blood pressure and thyroid medicine since I have changed my lifestyle. These are processed foods that are not health foods. Marketers will get you the little gummy fruits in the top left corner that kids love to eat. They're gummies. They might have fruit juice in them, but that's not necessarily healthy. The granola bars, breakfast bars, breakfast cookies. If it's a cookie, it's a cookie. It's still a cookie even if it looks healthy and says it's high fiber on the label. So beware of these. It's not something that you should be eating every day. It may be something that you can have for a snack or a treat, because there are healthier versions of granola bars and healthier versions. But don't think that that's a substitute for the fruits and vegetables and the whole grains and the adequate breakfast. It's not a substitute. Yogurts, one of my favorite. Everybody eats yogurt. I forced myself to eat yogurt for years because I was told and believed that it was healthy. Yogurts have a lot of sugar in them to taste good. So look at the back and see how many grams of sugar are in your yogurt. And they also have dairy protein, which we know now is associated with asthma and psoriasis and eczema and reflux and a lot of these other things. And the Gatorade sports energy drinks. Gatorade was designed for athletes like Clemson football players who are out doing two-a-days in the summer in the heat, and they're working and breaking down muscle and becoming dehydrated. It's electrolyte replacement for that type of workout. 6-year-olds playing t-ball are not getting that kind of workout. They're standing in the field looking at bugs most of the time. And yet we're giving them Gatorade because this is a standard sports drink. And it's full of sugar, and even the low sugar ones have chemicals. When you look at the back of the labels, you will not recognize most of the words in the ingredients. So trying to change that culture is very difficult because those are felt to be healthy foods, but Gatorade is only a step above sodas.
19-year-old grandson drinks a lot of Gatorade, so he should.
There is no nutritional value in it, except the water. And really, I don't count it if it's got sugar added. Even the G2 is about half sugar, and it's got some artificial sweeteners, which, by the way, artificial sweeteners, just as bad as sugar. So your diet drinks count too. So the first step is stop the soda, even the diet, stop most of the added sugar, eliminate processed foods, and eat more vegetables every day. Eat your vegetables. That's the most important thing, is we don't get enough. And the inflammation, the chronic disease, it's inflammation inside our arteries. Your doctor's probably given you an anti-inflammatory at some point. Your cardiologist had told you these blockages come from inflammation. A heart attack, a stroke, it happens from inflammation. Drinking the water helps get the inflammation out of your body, up to half your weight. So if you take your pounds, if you're 200 pounds, take half of that, that's 100 pounds, that's 100 ounces of water. Now that's a lot. If you have kidney disease, you've got to be careful because you can't overdo it on the water. So, do this with your doctor's help. 8 to 10 fruits and veggies per day. That's a lot of food. 8 to 10 servings of fruits and veggies. That is probably the best based on science to be able to nourish and heal disease.
All the programs now that are showing to have fruits and vegetables in a processed state, is it like a smoothie?
A smoothie?
Isn't it better to eat the vegetable in its natural state rather than having it in a smoothie?
Yes. However, many people will only eat one. I have struggled to get some people to eat one a day, fruits and vegetables. So a smoothie is a good way to get extra. And I think smoothies are good, but if you're diabetic, I would be careful because it's almost like juice. It's a big load of sugar at once. So I would recommend diabetics, especially if they're on insulin, no more than 8 ounces or so. But people who don't eat greens, you can get a lot of kale in a smoothie and put some bananas and mango and chia seed and have a very healthy drink and get a lot in. People who have cancer and are really wanting the antioxidant, you can get more in a smoothie than you can by eating, because you could only eat probably 10 apples a day. You could just pack a lot more nutrition in a smoothie. So some people who want to hyper-nourish, that is one way to do it. But it shouldn't be the only way, because you're missing out on some of the fiber. And then quick add-ins. You can add greens. How do you get greens in a diet? When you're boiling pasta for the last couple minutes, throw in a handful of kale or spinach or something, just till it gets a dark green. You don't want it wilted. Pasta sauce, I use, instead of meat in pasta sauce, a can of white beans or some bulgur, which will thicken it up some. And those are whole grains, and those are high in protein. So those are much healthier than any of the meats, and it kind of gives the same satisfaction. Green smoothies, like we just talked about. Ground flaxseed. Flaxseed's an omega-3, just like you're told to eat fish because of the omega-3s. Well, fish is still a animal protein, which gives you some inflammation. Walnuts, chia seed, and flax are plant sources of omega-3s, and I recommend for everybody who has high cholesterol to eat flaxseed every day, ground flaxseed. That actually, I think, is the healthier alternative to fish oil. And that can be sprinkled on oatmeal or in a smoothie or on a salad. And that's it.